This is the Healthcare Education Transformation Podcast, a podcast brought to you by two physical therapists devoted to helping physical therapists and other healthcare providers become better educators to patients, students, the community, and each other by interviewing prominent and passionate people within the realms of healthcare and education. The Healthcare Education Transformation Podcast is intended literally for educational and entertainment purposes only. No clinical decision-making should be based on only one source, and therefore this podcast should not be used as personal medical advice. While care has been taken to ensure accuracy, occasionally mistakes and factual errors can be present, as we are only human. This is our journey on the road to becoming better educators, so get ready with your pen and paper as class is about to begin. Hello and welcome to another episode of the Healthcare Education Transformation Podcast. My name is Brandon Poen and I am one of your co-hosts, and of course, as always, I am joined by my other half, F. Scott Field. And today on the show, we have a very prominent physical therapist here. We welcome tonight Dr. Eric Chaconas. Now, for those of you who don't know who he is, he's an orthopedic physical therapist, researcher, and educator. He is an associate professor at the University of St. Augustine Health Sciences in St. Augustine, Florida. And he has numerous publications and research contributions regarding shoulder exercise and rotator cuff tendinopathy. While at St. Augustine, he also runs an advocacy program in which students can sign up during their lunch hour to hear from Eric and other guests to discuss advocacy and other issues related to the physical therapy profession. He is also the Director of Education and Research at Advanced Therapy and Wellness, and he is the Director of Clinician Development at Talent PT Staffing. He works in the clinic with individuals recovering from musculoskeletal injuries, pain, or those who desire improved physical performance. He provides practicing PTs an array of continuing education seminars surrounding the topics of exercise prescription and musculoskeletal rehabilitation. He is a faculty member for the Institute of Clinical Excellence, in which he teaches the Extremity Syndromes course. And I actually first met Eric at his first course with ICE at Flint, Michigan this past summer. He's also completed a ton of professional service and public service for the community and for the profession. And he's even been awarded the Rick Schutz Community Service Award from the Florida Physical Therapy Association, along with the American Physical Therapy Association's Emerging Leader Award in 2010. He's a fellow of the American Academy of Orthopaedic Manual Physical Therapists, Manual Therapy Certification from University of St. Augustine, Certified Strength and Conditioning Specialist from the National Strength and Conditioning Association. Now, Eric, thanks so much for all your dedication and passion for the profession, as you clearly have and continue to make significant contributions to the clinical, educational, service, research, and advocacy aspects. Now, of course, I realize I kept your bio very brief compared to what you've done and accomplished in your career thus far, but, was there anything that I didn't mention in the intro that you'd like our listeners to know about you?
No, I think that's it, Brandon. I appreciate it. I think that the advocacy stuff is the one area that I'm most fired up about. That's what I get excited to talk about. And I would love to dive into that deeper.
Yeah, Eric, in your opinion, what are some of the biggest issues that we're facing regarding academia and DPT education? And what is being done to advocate for these solutions to these issues?
That's a good question. It's tricky. I mean, there's so many, right? I mean, the big elephant in the room everybody kind of, talks about is the cost of education. So when you compare the cost of education versus the return on investment or the potential salary that a physical therapist makes, I think we are all astutely aware of that being the number one problem. Unfortunately, I guess the second part of your question, what's being done to advocate for that or what's being done as a solution for that, I don't know. That we're doing a whole lot. I mean, you've got some innovative programs, right, that are trying to create shorter programs, trying to create more efficient programs. That's important. But I just think it's something that we all need to be aware of. We all need to work towards. The universities, university administrators, I think our accrediting bodies, it's just the growth in our profession is tremendous. And you hope that we're not seeing some type of a bubble, right, where people eventually will recognize the return on investment isn't what it used to be, and eventually possibly lose potential applicants would be bad. I don't think that like the whole, and when I'm usually involved in advocacy, it's just that. It's like legislation and, social change and looking at public awareness and stuff like that. And that's not really where I see the solution to this issue of the cost of education. This is probably, it's a supply and demand thing, right? So as long as there are consumers or in this case, potential students wanting to get into PT school, you have sort of, I guess, if you will, a seller's market, right? And so being able to raise tuition rates or have a high tuition rate is kind of up to the market. What I think you'll see, right? And so like if you have certain programs that are able to do it more efficiently at a cheaper cost, I mean, typical capitalism would tell you that those would be successful, and that if there is a problem, if there is some type of a bubble, if we do see a downturn in applicant pools, that those programs would probably thrive. So I think it's probably up to every program to ensure its own sustainability and to ensure its own long-term success, just to have an eye on that, have an eye on tuition and have an eye on cost. Now, that's not the only, the original question that was what needs to change in academia. That's not the only thing. It's just, I think, the most important, the one that should be talked about the most. But there's certainly other ways we can update our curriculums and look at the future physical therapists and teach to the future physical therapists instead of maybe the physical therapists of today or even yesterday.
Yeah, Eric, I think that's a perfect segue even kind of into our next question. And Eric, what specific changes do you feel that DPT programs are going to need to make in order to advance our future clinicians to more of a physical therapist version 2.0?
It's just, I did a little stint in administration and was, serving in a kind of assistant program director role for a little while, and really wanted to focus on this a lot. And it's getting all the faculty to teach to the future of the profession. So envision the physical therapist of 2030, right? We're in 2017 now. Envision this physical therapist that's 13 years down the road. What is that practice going to look like? And what components of physical therapist practice will be present in the future that maybe aren't present today? And so the whole shift towards wellness and prevention and all. I know you guys have Mike Eisenhart on recently, and so like that whole model, right? That makes perfect sense. There's a tremendous opportunity there in the healthcare market to be on the preventative side of disease, and we as a profession, I think, are in the perfect position to do that. So you could certainly, teach towards that or integrate that type of content in your curriculum. I think more differential diagnosis. I recently have started teaching that course. So excited! It's like an area that I'm not, haven't historically had a lot of training in, not super strong in. But the lead faculty member for the course is a physician assistant and a PT, right? So he's got dual degree, and he is just the most skilled clinician in this area that I've ever gotten to work with. And so like learning from him and seeing the way that he teaches differential diagnosis is so much fun. But to me, that's huge, right? We're going to get more and more direct access patients. Our scope of practice is going to dramatically improve over the next couple of decades. And so we need to be prepared to meet that challenge. And I think, having that frontline provider mentality, having those differential diagnostic skills, being able to get right at the key kind of issues and really not get caught up too much in the weeds like we have historically. So like, I'll give you a good example. Historically, right, we used to spend in our curriculum, I can't even imagine how many hours on joint mobility testing, right? Joint mobility, thousands, let's just say that, thousands of hours training on joint mobility testing, right? But maybe 4 or 5 hours on nutrition, maybe really not even looking at healthy activity modifications, lifestyle changes, exercise-based interventions from a preventative standpoint. And so maybe investing more time in those types of things and less times on the minutia of the orthopedic aspect of the curriculum might be valuable.
Yeah, for sure, Eric. I think you bring up a couple of really good points in that. And, with all those changes, of course, to add in for that future physical therapist, I know you kind of talked about regards to these unique different programs that are kind of emerging now to have more of that innovative model and such. And I'm curious as to your opinion as well on, do you think that things are going to change in terms of, the content that's going to be tested on the national licensing exam and the curriculum changes in CAPTE? Do you think that's something that's going to change as well?
I think that those things are constantly evolving, right? My understanding, by no means am I a CAPTE expert or a FSBPT expert, but I do believe that there is revisions that go into that. So like I know, for instance, on our faculty, we have a lot of people that are item writers for the board exam, right? And so those people go to FSBPT, they go to the headquarters in Virginia every couple of years and they write questions for the test. So the content, on the board exam certainly is evolving because you're constantly bringing in item writers to write, contemporary questions. And then I know, CAPTE revisions, we constantly, when I had a lot of experience going through accreditation processes with CAPTE for our program, and there are revisions that happen quite frequently. And so, like, I'll give you an example. Most recently, I had a thing, and it was like, make sure, where are the role of genetics in your curriculum and how genetics relate to different conditions that we see and stuff like that. And that's not something that was there previously. So I think just like anything, right? There's evolution. It's just a matter of how dramatic is it and how fast does it occur.
Wow. Yeah, Eric, advocacy is such an important topic, especially with the issues that our profession's been facing, and introducing these students to these issues and how to be a part of the solution is really critical because they're just starting their careers out, right? They're just starting to help shape their professional mindset. So, what do you think is the best way to incorporate advocacy into DPT programs?
It's so critically important. I've always recognized that our profession is not where it needs to be, right? The education and skill set of the physical therapist isn't reflected in current practice, in current law, right? So in your state, how many state practice acts for PT practice truly reflect the education and skill set of the physical therapist? It's very hard to find one that does, right? We have a tremendous sort of set of skills that we can benefit society tremendously with, and yet we're limited legally in what we can do. So that is an injustice, right? That needs to be changed. Then on the other side of that, society isn't aware of the education, skill set, and value that the physical therapist brings to the healthcare model. So those to me are two of the most important issues that every student needs to be intimately familiar with. And it has to occur on day one. I truly believe that. And I noticed that over the years. When I slip and I don't invest as much time on the advocacy aspect of our program for our students in the early phase of their development, so first semester when they get in, if we don't get into one of their classes in the first 3-4 weeks and try to recruit them to come to the voluntary advocacy meeting, really sell it to them, really help them understand, we'll get a drop in participation. That class will go through the entire curriculum with less participation throughout their entire time. I'd be willing to say that class will graduate less leaders, less passionate physical therapists who go on to make big changes and make things happen in our profession. Conversely, the class where we get in early and we start hitting them with all the issues and help them better understand, the problems at hand and why they need to be involved in the big picture. It's so important that they get the why behind it all, right? So it's like Simon Sinek, start with why. They need to understand why this is all important. You go in there and tell them, hey, you need to be a member of the APTA. Hey, this is what we're working on. It's gonna fly right over their heads. They're not gonna care. But if you explain why, usually that gets them in. So anyway, when you get them in early like that and you embed these experiences into the courses, into the program, they tend to really buy into it. They drink the Kool-Aid, if you will, and they will eventually take it on their own. They will become almost self-sustaining in their involvement and the way that they pursue advocacy and try to do all the important things that we want to help see them, move the profession forward.
Yeah, and Eric, I know with the method that you've done, also incorporating the advocacy hour at lunchtime, I think that's a fantastic idea. And do you think you could kind of tell our listeners a little bit about kind of what you kind of do with that program?
Yeah, so that started in 2008. I was doing the fellowship down there at University of St. Augustine, and actually went to one of the kind of owners of the school back then. It was privately owned, and Dr. Patlin, I said, nowhere in the curriculum are we talking about and at that time, big thing was direct access through Medicare, POPs, physician-owned. That was a hot topic, physician-owned practice, and therapy cap, which has been like an issue for 20 years, right? And anyway, and she was like, "Yeah, go for it, go ahead." And she came with me to the first one and like kind of mentored me along. It was really, really cool the way that it worked out. But that caught on like wildfire, and we had our first guest speaker was Bob Rowe. He's in Jacksonville. At the time, he was the president of AOMPT and, just an incredible leader in our profession. And he, of course, like all the leaders, all the big people are always so willing to give their time for stuff like this. So he's like, yeah, I'll come down for lunch. So he came down, talked to about 50 of our students, got them all fired up, and that group of students was kind of the first group. They went to Washington, D.C. They raised money, went to the Federal Affairs Forum in Washington, D.C. for APTA, lobbying Congress on behalf of, the APTA and the patients that we serve and the therapists that are members. And kind of went from there. We converted it to give it a little bit more of a business angle a couple years ago, because it just felt like there wasn't enough. Everybody says this, right? There's not enough business education in PT school, which makes sense, because PT school, you're trying to learn the basics of practice, be a safe practitioner, pass the boards, all that. But certainly not enough business information. And what we did was we started bringing in kind of leaders in the world of business. And so, people talking about marketing and how to start your own practice, any cash-based practice, anything you can think of kind of within the PT world of business, that went over like a big hit. The number one session we've ever had, and number one in attendance, probably had like well over 100 students, 130 students, we did the topic of salary negotiation. So anybody that's out there looking to start one of these types of things, if you're in your school, if you can make it a little bit about finances and bring in some maybe salary negotiation discussion tips like that, it gets the students involved for sure.
Yeah, for sure. And I think that could even be used as a pretty good selling point too to future students. Like, hey, this program, we incorporate this too, because we realize that the situation here with the money and stuff, but we're actually looking for ways to help our students through that. So I think that'd be a good added thing in there, Eric. I think that's a good idea. And, kind of even going back to kind of more the advocacy route, Eric, what are some of the barriers that you, or others that for that matter, have come across with being a supporter for advocacy within education? And why do you believe that these problems exist, if there are any?
Well, the number one problem is that it's not a mandatory. I mean, it is actually. There is a CAPTE criteria that integrates. I can't quote it word for word, but it integrates this topic to some degree. So they do want to know that students are exposed to the professional issues. They do want to know that the students understand how to address those issues and kind of what's being done. And I've heard of faculty really integrating, almost embedding into a course, right, the component of professional advocacy and getting into direct access or physician-owned referral for profit and dry needling, whatever the issues, right? The number one barrier, I think, is probably if you don't have a faculty member, right, who's involved in the profession and really trying to drive the profession forward, it's going to be hard, right? I mean, how are you going to trickle these concepts and this passion down to the student body if there isn't faculty leadership sort of actively practicing it and actively doing it? So I think that's one barrier. You want to try to hire faculty that are involved and not involved in the way of like they serve on a committee because it's a requirement of being a faculty member. Involved like they wake up every morning fired up to drive the profession forward, and they eat and breathe this stuff. That's I think the kind of person you want. And then the other barrier is time, right? So like students, and I get this a lot of students say, I want to be involved, I want to do this, but we have like 6 tests this week and I'm slammed. And I get it, right? That's understandable. What I tell them is, because they'll say something, they'll use the word, they'll say, I can't afford to come to the advocacy forum. I just don't have enough time. And I'll respond with, you can't afford not to come. Because when you come to the advocacy forum and you understand the issues and you become more passionate about the profession and you understand what you need to do to drive the profession forward, everything else becomes easy. That anatomy test all of a sudden doesn't feel so hard. You also have more passion, as you study and as you pursue, the different components of the curriculum. And so I think it helps you understand the big picture, which focuses you, which makes school more enjoyable, and you're more successful.
Yeah, Eric, that's a great point. It's almost like an investment on your future self, right? Because if you're not investing in the profession, really, you're doing damage to your own career in the future.
We make them all be members of the APTA. Why are we members of the APTA? And you get the typical, I understand, like I get the journal. I understand that I get like discounts on some things. And I'm like, no, hold on. This has nothing to do with that. This is insurance for your career. Right? The APTA is pretty much the only organization that is on Capitol Hill on a daily basis representing you. And so that's the only prayer you have of having any legislative representation whatsoever. When these issues arise with Medicare and direct access and scope of practice and payment reform, that's your representation. I'd gladly pay somebody $500 a year to take care of all that for me. I mean, that's well worth it.
Yeah, I that's one of the reasons that I say this time and time again, but it's one of the reasons that I'm paying my APTA dues and putting money toward the PAC, because I don't know a lot of those things. I'd love to learn more, but at the very least, I know I can support the people who do know it and who can do the good work that we need done for the field of physical therapy. So, Eric, I have a two-parter on this next one here. The first question is, what do you think are some of the most effective strategies that one can use to maybe address with some of the higher ups in the DPT program to really hammer home the fact that advocacy is really needed? And part two to this question is, do you think that we might need to look into changing candidacy for faculty and adding maybe an advocacy component?
I do. The second thing, so here's the thing about the second part of that, right? When you look at a faculty member, do they get the big picture? Are they trying to drive the profession forward? What we're talking about is best embedded within a course. So rather than have people come to lunch and I bring in Jerry Durham to talk about, private practice or payment or something like that, right? And instead of that, when we are covering hip osteoarthritis in our orthopedic class, we talk about the prevalence of hip replacement, the costs related to osteoarthritis, the management strategies that exist, and the opportunities for physical therapists in private practice to go out and create osteoarthritis prevention programs or rehabilitation programs. So you're literally embedding it all, right? Rather than saying you have a class on private practice, or business, you have a class on musculoskeletal. It's all kind of threaded, right? Threading is a key.
Yeah, big picture, kind of naturally woven in throughout the semester.
Exactly. And then the first part of your question, F. Scott. So like how do you influence the higher ups? How do you influence the big change in the program? This is my whole thing, and I've never really been successful with this, and nobody's actually given me a good response yet. But I still think this is the way to angle it. The health of the profession, right, is directly correlated to the health of the program and the university. So if you are looking to create a legacy program that is healthy financially and strong and does great work and graduates amazing students year after year after year, you need a healthy, strong profession. And the stronger the profession is, the greater our scope of practice, right? The greater need in education to have a high level educational experience. So you're literally strengthening your own program by strengthening the profession inadvertently.
Yeah, no, that's a good point, Eric. And Eric, for all the PTs and SPTs out there who are perhaps not aware about this, where do you recommend that people go to learn more about the current issues facing PT and how to contribute to the solutions through advocacy?
APTA.org for sure. That's an awesome resource. I was going to try to type it in real quick and tell you the button, but I'm pretty sure you click on something like advocacy or legislation or something like that, and you will have days worth of reading content. They break it down into kind of federal issues and state issues. And, so that's important, right? It's important to get familiar with the federal issues, things that we would address in Capitol Hill. Going to the federal, I don't know what they call it now. It used to be the Federal Affairs Forum. I think it's like the Federal Advocacy and Payment Forum or something like that. But that's held every year in usually like Alexandria, kind of Washington, D.C. area. And you get about a day's worth of programming where you learn about all the issues. They have lots of guest speakers. They have congressmen and women. They have lobbyists. All these people come and talk to you. And then you the next day you go out and you lobby the government on Capitol Hill. And so you go visit with your lawmakers alongside other PTs and students. And it's just such an awesome experience. They do the same thing usually at the state level too. Most states will have the same type of an event.
Interesting, Eric. And I just looked up online, and you do not have to be an APTA member to access that. So that's free and open to anyone who goes online.
Awesome. Yeah, Eric, you kind of mentioned earlier that, the cost of the DPT programs are rising, and that's basically the market that's kind of causing that. The market dictates what the price of these programs are, but where does all that money go for the educational costs?
I'd love to know the answer to that. No, I'm not familiar enough with that end of the spectrum. I mean, yeah, like the state university system. I have no idea how that works. I have no idea how the public system works. I mean, in a for-profit private institution, I'm imagining it goes into the shareholders or wherever profits of the business go. But it's a good question. I mean, I would love to know. What is the profit margin for a DPT program? I think some programs are probably actually operating at a loss. I mean, you do have some public schools, state schools that have lower tuition and probably are utilizing I know actually are utilizing state funding to keep the program afloat. So they're not entirely tuition sustaining. But John Childs made this point once. He spoke at the Graham sessions and he said, whether it's a private or a public school, you are paying the tuition. And what he meant was like it's either your tax dollars or your direct tuition dollars, but we're all paying for DPT education to some degree.
Yeah, that's a really good point. Eric, I want to pivot a little bit here and ask you a little bit more personal question. You've done a lot of teaching over the years, right? And I'd like to know maybe some of the differences that you have found in teaching online versus teaching in the classroom versus teaching a CEU class. Like, do you notice any marked differences amongst the different types of teaching?
Yes, it's huge. I mean, like my skill set does not necessarily lie in online teaching, right? That's something I've had to really work on and develop over the years. It takes a different skill set. It really does. We have some faculty that are so amazing at online instruction, and they will provide a completely different experience for a student in an online classroom than a faculty member that's not as good at that. So it's just engagement, right? How do you engage the students? Are you good at engaging people face to face? Do you come alive in the lab, and can you really show people for the psychomotor skills aspect of it, or the hands-on component, or are you really good with technology? Are you really good at stimulating critical thinking and engagement in an online environment? I mean, online is tough, right? Because there's a distance between the instructor and the student. And you losing that face-to-face component hurts me. I think that I'm less connected, less engaged because I'm just not as skilled at it. Con Ed is a whole different world, right? Because continuing education is kind of nice. I actually really love it because these are clinicians who are struggling with day-to-day clinical dilemmas. So they come to you with a whole different kind of mindset than an entry-level student does. And the entry-level students are great as well because that's like a blank slate, right? You can help them build kind of their career and their practice philosophy. But in Con Ed, I think the stakes are a little higher. You really got to deliver and help people, improve clinically.
Yeah, for sure. And I think even, Eric, what you did was, you would, at least from the class one I took from you, is you were able to really break down kind of the big concepts, basically also with the research as well, but also add in some different spins on different ways and really and I love how you were able to modify it based on the clinician. Like you kind of targeted those that are working in more of an active and sports environment compared to those working more in a geriatric environment to kind of make sure you hit all angles. And I think that was very important and very helpful.
Yeah, I would like to say, so like one thing I think like for teachers, right, we're all like kind of good at something, right? It's almost like a clinician. You sort of have your angle, your niche, your thing that you're good at. And one of them that I think is important that I've always tried to work on is being able to really break down concepts in an easy to digest manner. And then from there, once you break it down and everybody's kind of on the same page and they all really understand where we're headed, then adding complexity. Right. And it's sort of, I mean, I'm sure, F. Scott, you know this from your EDD, like educational theory, right? And looking at the domains of learning and all that sort of stuff. But being able to do that kind of quickly on the fly is pretty important.
Yeah, very important, but also very difficult. I'm learning it definitely takes time and practice.
Yeah, no, those are some good points, guys. And, Eric, we normally ask this question at the end of each episode, kind of as a wrap up to all our guests, because we're curious what everyone's thoughts are. But the question is, if you could change one aspect of DPT or healthcare education, what aspect would you change and how would you change it?
Yeah, thanks, guys. I listened to a lot of your episodes in preparing for this. I've heard a lot of people answer this question. I heard Todd Davenport answer this question. He had an awesome answer. A lot of people have had great answers, but I thought about this a lot, and I thought, what would be one thing that would give us the most bang for our buck? That would be relatively simple to do, and it's simple, right? I would advocate for a schedule change. What I mean by that is currently, right, you do all your didactic learning in the first year and a half of your PT program, 2 years sometimes, and then you go on internships. So that's a bit of a fragmented process in and of itself. And I think all of us remember that as going through PT school, right? Where like the daily grind of class all day long, I'm learning all this stuff, but I'm not applying it right away. That I think you lose a huge opportunity to cement some skills and some learning. So my schedule change would be class in the morning, clinic in the afternoon. Now, it's only going to work for a small PT program that has a large number of clinics and facilities around it. And any ACCE listening to this is like wants to shoot me right now. They're like, But I heard this. Somebody from like New Zealand told me this once. They said, when I went to school in the 80s, or maybe it was Australia, we took class in the morning, and then you went out and you treated patients all afternoon. So can you imagine the learning that would occur if I'm in the morning dissecting the shoulder in the anatomy lab, then I go to my biomechanics class and my ortho class, I'm practicing my techniques, and then in the afternoon I immediately have to deal with Glenda, who has rotator cuff pathology. And I immediately apply all the skills that I learned in the morning on a real live patient scenario. And I do that throughout the entire curriculum. Same total number of hours, same amount of internships, but it'd be, I think it'd be awesome.
Yeah, definitely an interesting take on that, Eric. I think it would be difficult coordinating some of it, given if you like you said, you kind of learned about the shoulder, then you had to go treat a shoulder patient. Well, you had to have a shoulder patient ready and willing, so I definitely think that could pose some difficult scheduling things, but I definitely like the outlook. I like the outlook on that. Well, Eric, I just want to take a moment to thank you personally for all the help and guidance that you've given me in the world of my journey and the direction I'm trying to head or not head regarding academia and just general education. So thank you for that. But would you mind telling our audience a little bit about where they can find you online and on social media?
Yes, I am at Chaconas on Twitter, ECHACONAS. Not as frequent on Twitter these days. Like I'll check it like once at night or something, and every now and then make a little comment or something. But I'm on Facebook a lot these days. So I'm on Facebook, and then with the Institute of Clinical Excellence, we try to do like a daily show. And so I'll get in there on Tuesdays every now and then. So you can see me there. I try to post little techniques, little tips, kind of short little 5 to 8 minute kind of technique tips. People tend to like that. So that's a lot of fun. But yeah, anytime anybody needs me, reach out, please do. I have a website, chaconaspt.com. And that has my contact info also.
Awesome, man. Thanks so much for coming on tonight. We appreciate your time.
Yeah, we do, man. Thanks, Eric.
Thanks, guys.
Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.